Well, some top health groups releasing new guidelines on how to fight high cholesterol. They created an online calculator to help doctors figure out who's at risk and what treatments to use. But now we're hearing that the calculator is flawed. It was big news last week. We even mentioned it on the program. And we got to revisit it. Dr. Ernest Patti is with us from St. Barnabas Hospital in New York City. So what about this calculator? We thought it was going to be as easy as putting a few things in and figuring out if you needed help.
What people tend to forget is the art of medicine requires doctors to get information about the patient's family history, medical history, physical examination, lifestyle, risk factor, things like that. Put it all together and figure out what your risks are for certain diseases. It's not as simple as just plugging it into a calculator. You know,
there's not an app for that?
No, there's no app for that yet, but the calculator is only as good as the information we put into it to help us figure out what the risk is. And if the information we're using is, say, old or a little flawed, that could affect the outcome.
The concern was that maybe too many people would be thought to be at risk for high cholesterol, other issues, and so that was one of the big headlines that came out of revisiting this calculator.
Exactly, and the concern is you don't want to start people unnecessarily on medications like these statin drugs if they don't really need to be on them. And that was the biggest concern that I found from reading the article.
Okay, we're going to keep that in mind when we go to the doctors. I have to ask you about this other topic coming from Britain. In a journal there, some medical doctors are saying in a couple years we're going to be in a post-antibiotic age where we're going to have to weigh, do I want to go get that surgery to help me out and risk getting sick at the hospital? You work at a hospital every day.
I work at a hospital every day.
Are we 20 years away from this period? How far away are we from this period?
I couldn't give you an exact time, but I can tell you we do talk about superbugs every day. And by superbugs, I mean bacteria that are resistant to our normal antibiotics.
If antibiotics don't work, what is our backup plan?
That's a good question. Basically, what we have to do is remember to use common sense, and maybe we're overprescribing them. That's always been thought to be the reason why we're developing these superbugs. So, you know, don't prescribe them unless they're necessary. Only use the first-line antibiotics and only go for the big guns when the infection warrants or the patient is very sick and requires the very strong antibiotics.
Dr. Patti, patients are lucky to have you.
Oh, thank you so much.
I like it. John, wouldn't you like to be treated by Dr. Patti? You have to keep it in mind. Everyone needs to go to the hospital.
You're always welcome to come visit me at St. Barnabas in the Bronx.
I'd love to visit, but maybe just healthy.
Yes.
Dr. Patti, great to have you. Thank you.
Thanks so much.
John?
Just bringing flowers to a friend. That's why I like to go to the hospital.